Good day, listeners. In this video presentation, we will be discussing about our social innovation project, which is entitled the MediTrack Smart Pill Dispenser for Better Medication Adherence. And these are my members: Adolfo, Cosico, Dueñas, Mancilia, Ilya, and Solis. Before starting this presentation, this is the discussion structure of this video presentation. First is the abstract, introduction, objectives, methods, then the expected outcomes, evaluation, also the sustainability and future directions, and lastly, the conclusion. Now let us formally start this discussion with the abstract. This study introduces MediTrack Smart Pill Dispenser, a cost-effective and user-friendly device aimed at improving medication adherence among elderly individuals here in the Philippines. Medication non-adherence, often caused by forgetfulness and cognitive decline, leads to poor health outcomes and increased healthcare burdens. Traditional solutions like pill organizers are not enough to address these challenges, especially in aging populations. Thus, MediTrack offers an innovative solution by combining automated pill dispensing, customized audio-visual alerts, and real-time caregiver notifications to ensure timely and accurate medication intake. This study aims to evaluate the device's functionality, usability, affordability, and effectiveness in both household and healthcare facility settings. Through prototype testing, user feedback, and performance assessment, the research seeks to validate MediTrack as a practical and culturally relevant tool. By enhancing medication adherence, the device not only supports patient autonomy but also reduces caregiver workload and contributes to the advancement of the assistive healthcare technologies. Now, let us move on to the background of the study of this social innovation project. Medication adherence is referred to as how well a person follows their healthcare provider's recommendations, whether for diet, exercise, medications, and other lifestyle changes. Essentially, this suggests that it is an agreement between the prescriber and the patient about the prescriber's recommendation, which definitely contributes in achieving therapeutic goals and patient outcomes. Thus, in contrast, non-adherence may result in restricting maximum benefits of medicines and lack of condition improvement, supported by the National Institute for Health and Care Excellence. Having said that, medical adherence is crucial for the treatment of every patient. A study conducted at American College of Cardiology found out that the most common cause of unintentional medication non-adherence was forgetfulness. It is considered inevitable because as humans, it is natural for the brain to prioritize thinking about the most important information rather than the less irrelevant ones. Also, stress and age could also be a huge factors. That is why older people tend to forget complying properly in their medication schedules. Having said that, even though pill boxes are made in order to organize medications good for a certain period of time, it is not enough to address the stated issue: medical non adherence related to forgetfulness. This is the reason why medicine dispensers are designed. The initial research and development of this was in 1985 as one of the first electronic pill dispensers with alarms was introduced in Boston, Massachusetts, and in 2018, Hero Health, a platform known to help medications easier and more convenient, launched one of the first AI-powered pill dispensers. Through technology, automated medicine dispensers were produced. This greatly helps patients struggling to remember what and when they will have their medicines throughout the day. Because of this risk of making one's condition worse because of forgetting to administer medicines, it is an alarming issue that may be a simple one but could be a regretting effect at the end. Particularly for elders, skipping medications from time to time already became a common circumstance because they forget their medication schedules. Through automated medicine dispensers, elderly patients today have the access with such advancement to improve their medication adherence for good health outcomes. As automated medicine dispensers are evidently not fully known and accessible, considering lack of awareness and its costs, is an essential to design it suitable for masses in terms of its operation and cost. The researchers were able to come up with a technology of medicine dispensers that are user and cost friendly to benefit especially Filipinos. MediTrack offers a comprehensive medication management system with several unique features designed to enhance patient adherence and safety. One of its key components is the automated pill compartments, which clearly labeled and designed for different medications. Each compartment is equipped with a secure access door that opens automatically when it's time for the patient to take their medication. This prevents accidental intake of the wrong medication. In addition, MediTrack sends reminders and alerts to the patient when it's time to take their medications. These reminders include signaling lights in the corresponding compartment and an audible alarm to ensure the patient doesn't miss a dose. If a dose is missed, the system features light indicators on the specific compartment to notify the patient of the missed medication. To further support medication adherence, MediTrack includes a real-time tracking system that allows healthcare providers and guardians to monitor the patient's progress. They will receive notifications when the medication is running low, prompt, prompting timely refills and when a dose has been missed, ensuring that the patient stays on track with their medication schedule. This study creates an accessible technology advancement for communities of the Philippines in order to address medication non-adherence. This also depicts giving value to an effective patient care through ensuring better medication adherence from them. Now, let us move on to the statement of the problem. The researchers aims to produce more efficient, user and cost-effective, but good quality smart dispensers which can help solve medical issues, specifically medication non-adherence of elderly patients, mainly because of forgetfulness. Specifically, the research aimed to address the following inquiries. First, what are the key features of the smart pill dispenser that enhances its use and dependability for elderly patients facing medication non-adherence because of forgetfulness? Second, is there an increase in the elderly patient's independence and confidence in managing their medication using the smart pill dispenser? And the third one, how does user and cost friendliness of the smart pill dispenser impact the accessibility and adoption among elderly patients and their healthcare providers? Now, let us proceed to the next one.
Now, for the significance of this prototype development, through this study, the project of an efficient, user, and cost friendly smart pill dispenser will be able to contribute to the awareness and improvement of medication adherence not only among elderly patients but also to the following. And as you can see here, we have three target consumers. First, for hospitals and medical staff. As our project offers a tool that can improve medical management, this can definitely aid those of inpatients, outpatients, and long term care residents, helping reduce human error in medication dispensing. Second, we have here patients. As per this one, our main target is particularly the elderly. This is because this device will serve as a helpful guide to follow their prescribed medication schedule, promoting effective treatment and better health outcomes. Then, most importantly, of course, as I mentioned earlier, one of our main target consumers are the elderly. However, our audience is not only inclined to these three. That is why for this prototype device, the product itself is designed to be affordable and accessible while still maintaining a good quality. In this way, our consumers can be as diverse as possible. For example, more Filipinos could actually benefit from this technology without compromising the quality. Then lastly, for students like us, this study opens doors for deeper exploration into health innovation. Then digging deeper, it actually encourages creativity, critical thinking, and the drive to develop solutions that matter, not just in theory, but in real life. Through the conduct of this study, we could actually say that this smart pill dispenser is more than just a project. Rather, it is a step towards a healthier and more empowered community.
As for the next one is the scope and elimination. So this study focused on the development of smart pill dispenser that aims to improve medical adherence among patients, particularly elderly, as there is a huge tendency of forgetfulness among them. Further, this study will focus on the efficiency, affordability, and ease of use of smart pill dispenser and how key features of it help prevent missed doses and medication errors. Whereas, this study does not focus on other factors of medication non-adherence faced by the patient, such as personal choice and beliefs, financial barriers, and others. This study is also limited to elderly patients and will not include younger ones, individual with chronic illness, and hospital inpatient or outpatient. So further, the study will focus on the innovation project itself and will not compare to different models or technologies from other manufacturers in the market having the same product.
Moving on to the conceptual framework, this study highlights how efficient, affordable, and user-friendly the device is. We focus on how its key features work together to prevent missed doses and medication errors. Moreover, these benefits help improve medication adherence among patients, making it easier and safer for them to manage their medications every day. Here, presenting our research paradigm, IPO, in the input part, we identify the problem, gather data, bought hardware, developed software, and considered user needs, especially for the elderly and hospital staff. Now the process, it involves designing and assembling the dispenser, adding features such as automatic dispensing, alerts, tracking, and security, followed by testing and improvements based on feedback. And then finally, the output is our smart pill dispenser that is efficient, cost-effective, and user-friendly. So our conceptual paradigm, it provides a clear structure and flow of the entire process of the project. It also helps to understand how the smart pill dispenser is designed, implemented, and evaluated.
So today I'll be explaining the objectives of our project titled MediTrack Smart Pill Dispenser for Better Medication Adherence. So our project has 6 main objectives. First is we aim to develop an efficient, user-friendly, and cost-friendly smart pill dispenser. So we want to create a helpful automated medicine dispenser that is affordable without compromising quality. So it should be easy for elderly users to understand and operate. So second is we plan to provide an efficient medication reminder system. So this includes using alarms, lights, and sound notification to remind elderly patients when and what medication they need to take at a specific time. So third, our goal is to prevent medication errors. So we want to improve medication adherence among the elderly by helping them to take the correct medicine at the right dosage and times. Fourth is we aim to improve monitoring and caregiver assistance. So the device will have real-time tracking features and will notify the caregivers or guardian if a dose is missed. Fifth is we will evaluate the cost effectiveness and feasibility of the device. So this means that we'll assess if the pill dispenser is affordable and practical for use both at home and in healthcare facilities. And lastly is we aim to validate the effectiveness of the smart pill dispenser in improving medication adherence. So we'll gather feedback and measure how well the device helps elderly patients stay consistent with their medication. So that concludes the objectives of our project. Thank you for listening.
Now for the methods used to assess the feasibility, functionality, and user-centered design of the MediTrack Smart Pill Dispenser, we, the researchers, employed an experimental method grounded in iterative prototyping and evaluation. This process was designed to systematically test the device's capabilities in addressing medication non-adherence among elderly patients. Specifically, due to forgetfulness while ensuring ease of use, affordability, and practical implementation in both clinical and home settings. For the materials and tools that were utilized, we first have here the microcontroller unit, which is for programming and control functions, then the real-time clock RTC module to maintain accurate medication schedules, the servo motors, which is used to control the opening and closing of individual compartments. Then next are the light emitting diodes or LEDs, and then the piezo or piezoelectric buzzers for visual and auditory alerts. Then we also have here a Wi-Fi module to enable real-time remote notifications and monitoring. Then of course, one of the most important components, the power source, which is a rechargeable battery pack or standard power adapter. Then next is the prototype housing, which is fabricated plastic container with segmented pill compartments. Then the Arduino IDE and open source code for program development and integration. Then lastly, we have the smartphone interface, which is optional for future expansion. So this one is specifically for caregiver and patient alert. And then now for the next slide, we have here the procedure of development. So the following are the development and evaluation process that are involved. First, the design and assembly. In this part of the development, electronic components were installed within a customized casing, creating discrete and labeled compartments capable of automatic actuation and at scheduled times. Then second, we have here software configuration. This is where the team developed an open source program that synchronized the RTC module within the dispensing system, activating alarms and notifying caregivers in real time. Third, of course, is the prototype testing. This key step is pivotal as the initial prototype was tested in a controlled setting, simulating everyday use by elderly patients. The key performance indicators included timing accuracy, responsiveness to alerts, and user engagement. Next, for the fourth one, user evaluation. Test participants, including elderly volunteers and caregivers, provided structured feedback on usability, system reliability, and perceived benefits in terms of medication adherence and independence. Then lastly, we have the data analysis and refinement. Observational data and qualitative feedback were synthesized to identify areas for refinement. Then modifications were also made to improve alert visibility, reduce user error, and enhance overall system performance. Subsequently, these key steps into creating the prototype enabled the researchers to develop a comprehensive understanding of Meditrack's impact and effectiveness. The iterative approach ensured that each phase of the experiment directly informed subsequent enhancements, ultimately contributing to the creation of a functional, user-friendly, and scalable smart pill dispenser tailored to the needs of Filipino elderly populations.
So for our expected outcomes, the development of innovative automated smart pill dispenser that could help the medical issues could have a immediate impacts and long-term impacts. So for the immediate impacts, we have first the improved medication adherence. So the smart pill dispenser can effectively alert patients, especially elderly users, take their medication on time, which decreases the instances of missed doses due to forgetfulness. And then second is patient assurance and independent capability. This system helps elderly patients manage their medication schedules independently, reducing reliance on caregivers and fostering greater confidence and also self-assurance. Next line. Third is prompt detection for early signs of treatment non-compliance. So through intensive monitoring, notification and alert features of any missed dose or delayed intake can be immediately identified, which allows caregivers and healthcare providers to intervene early and prevent more serious health consequences. And the next is reduce incidence of medication administration errors. So the smart pill dispenser decreases medication errors by automatically separating medications for safe and precise medication release while reducing improper drug use of wrong amounts and incorrect times that often affects elderly populations. So for our long-term impacts, reduction of medication-related health risk, the long-term utilization of automated medication dispensers notably decreases medication-related health risk arising from missed doses or incorrect medication consumption. Consistent adherence to prescribed regimens results in improved patient outcomes and reduced emergency department visits, thereby strengthening the healthcare infrastructure. Next is expansion of access and integration into diverse care setting. Its affordability, user-friendly interface, and practical design, the device holds strong potential across various healthcare settings, including homes, hospitals, and clinics. Its inclusive features ensure equitable healthcare access, particularly benefiting vulnerable populations in rural and underserved communities. Stimulation of local technological innovation in healthcare. The successful execution of the project creates momentum for future technological advancements within the local healthcare sector. It encourages a resilient and innovative health tech ecosystem tailored to regional needs. And then, the advancement of academic inquiry and interdisciplinary research. The initiative paves the way for academic exploration in areas such as health informatics, human-centered design, and geriatric care. By bridging healthcare and engineering disciplines, it cultivates a socially responsive research culture that empowers scholars and practitioners to develop innovative and compassionate solutions. Next is influence on policy development and clinical practice. The device serves as a model for integrating technological interventions into public health system, underscoring of the importance of proactive preventive care. These initiatives contributes to shaping health policy and reimagining clinical practices, demonstrated improvements in medication adherence, and patient outcomes offer a foundation for future guideline formulation and the refinement of national policies on elderly care and chronic disease management. So for my last part, the anticipated benefits to elderly users of producing smart pill dispenser as an innovative system for better medication adherence include: first, improve health outcomes and patient safety, MediTrack. It resolves medication non-adherence problems through its system, which delivers automatic prescription delivery notification and dispenser control distribution mechanism. The system delivers significant protection against medication complications since it was developed particularly for elderly patients and those dealing with chronic conditions. So the system generates improved wellness results and decreases both hospital stays and emergency healthcare service workload. Next, increased accessibility and health equity. Affordable and friendly user interface design enables MediTrack to introduce intelligent healthcare solutions to every type of facility, serving residential patients and medical centers and elderly care institutions located in rural or underserved communities. The inclusive medication management approach of the device creates better health equity to help various communities effectively and independently administer their treatments. So for last, innovation, education, and policy influence. The creation of MediTrack uses three key areas of expertise to unite engineering, healthcare, and information. Technology purposes, which will advance medical technology innovation in the future. Analyzing its impact may lead to national health policy and changes in elderly care and chronic disease administration, alongside encouraging standard healthcare practices to integrate technology and determining new paths for patient-centered care. Thank you.
Good day, my name is Ilya Friday, and today I'm going to evaluate the project topic, which is MedTrack. So in this level 1, I'm going to talk on the key features enhancing use and dependability. So we have setup, feature tested, user feedback, which is 1 to 5. Then we have observation. So in setup we have A, B, and C. Then feature tested we have audio visual alert. Then for the user feedback we have is 1.7. Then the observation, alerts were effective for users with forgetfulness. Audio reminder help most. Then in setup B, feature tested, we have automatic dosage dispensing. Then the user feedback is 4.5. Then the observation, users trusts the dispenser, no miss, doses recorded during testing. Then the setup C, in feature tested, locking mechanism for missed doses. So the user feedback is 4.2. Then the observation, prevented overdosing, appreciated by caregivers and users alike. So table 1 shows MediTrack smart features like alert and auto dispensing, improve ease of use and reliability for elderly users with forgetfulness. So in table 2 is impact on independence and confidence. So as usual, in table 2 the setup is A, B, and C. So and we have before using MediTrack, self-rated confidence, and we also have after using MediTrack, then observation. So in setup A, before using MediTrack is 2.5 and a half. Then after using MediTrack is 4.3 and a half. Then the observations, users reported feeling more in control, less reliance on family. So B, before using MediTrack is 3.1 and a half. Then after using MediTrack is 4.5 and a half. Then the observation, noted increased punctuality in medication intake. So the C, before using MediTrack is 2.5 and a half. Then after using MediTrack is 1.4 and a half. Then the observation, significant improvement, especially among those with male cognitive decline. So this table 2 shows using MediTrack increase elderly patients' confidence and independence in managing their medication. Thank you. So in table 3 is cost and accessibility evaluation. So the setup is A, B, and C, and we have a cost scenario, we have user satisfaction, which is 1 to 5, and we have adoption likelihood, then we have uh, observations. So in setup A, which is the cost scenario, full price unit is 3000 peso, then the user satisfaction is 3.7, then the adoption likelihood is medium, then observation, uh, perceived as expensive but justified by effectiveness. So B, the cost scenario, LGU subsidy is 50% off, then user satisfaction is 4.6, then adoption likelihood is high, then the observation, uh, major express willingness to adopt if subsidized, then C, the cost scenario, uh, free demo unit via barangay clinic, then user satisfaction is 4.9, then adoption likelihood is very high, then the observation, um, high engagement, ideal for community health rollout. So uh, this table 3 shows lowering the cost through subsidized or public programs made Meditrack more uh, accessible and appealing to elderly users and healthcare providers. Thank you.
So, for the sustainability and future direction, the innovation project of Meditrack, Smart Pill Dispenser for Better Medication Adherence, is designed with long term feasibility and real world relevance in mind. Its sustainability is embedded in three types. These are the following: first is the environmental sustainability, second is the social sustainability, and third is the economic sustainability. For environmental sustainability, the innovation project can make a meaningful contribution to environmental sustainability. It is an innovative and environmental project that can track medication adherence and set alarms to notify the patient. It is different from the traditional medication dispenser that is only a secure plastic container designed to cater medication with compartments depending on the patient's needs. It can also reduce the reliance on traditional medication dispenser, whereas this lessen the use of plastic in creation of it. This achieves more eco-friendly device where the creation of the said project device uses low power electronics and recyclable materials, reducing environmental impact. Solar powered or energy efficient batteries option can be explored in future iteration to further reduce the device carbon footprints. As for the social sustainability, the use of Meditrack Smart Pill Dispenser for better medication adherence can raise the quality of life in urban environments. As said, this lessens the use of plastic that can reduce the plastic pollution that can release toxic chemicals. The project is designed to be cost friendly both in production and usage by incorporating an open source software. Development and manufacturing costs are kept low, making the device accessible for both low and high income users. It is potential to reduce healthcare costs by improving medication adherence to be a key to solve the elderly medication non adherence. So, implementing Meditrack Smart Pill Dispenser for better medication adherence can function as a solution for forgetfulness of elderly and medication adherence. It has the potential to involve the elderly population and provides their specific needs for the said device. Additionally, these initiatives can serve as an eye opener for people to be aware of the importance of right time and right medication for patients to be well. For economic sustainability, embracing the use of technology can generate better innovation. This can positively impact the economy since it provides a solution for medication non adherence for elderly patients. Furthermore, the use of local software system and materials can support economical industries and practices. The smart pill dispenser system promotes improved health outcomes through better medication compliance, particularly among elderly. Its initiative design and alarm notification interface make it user-friendly and inclusive, accommodating elderly patients across different socioeconomic backgrounds. For the future direction, in order to improve the innovation project entitled Meditrack, the following are the proposed future development. First is the mobile app expansion. Second is the scalability for other health condition. And third is the user feedback driven design. First one is the mobile app expansion. In the future, technological advancement are a factor that can support the project enhancement and mobile app expansion. As softwares and materials needs improves, the creation of the device, its system and connection to mobile phones become more easier, systematic, and standardized. Technology can enhance the companion mobile application in several ways. It can create features like push notification, caregiver alerts, refill reminders, and telehealth integration that can empower users, specifically elderly and caregivers, to manage medication adherence effectively. For scalability for other health conditions, although the innovation is initially targeting general medication adherence, the system can as well as be adopted for more complex regimens. These regimens are for those patients with heart disease, stroke, cancer, diabetes, arthritis, osteoporosis, and dementia, which require strict compliance. The scalability of the system means it can go beyond basic reminders of medication adherence into a personalized health management tool. This featured accommodation of unique challenges for specific condition and offer holistic support for elder patients. Last is the user feedback driven design. One of the strategies to measure the innovation long term impact is to monitor user feedback. This will be essential in refining the device, usability, accessibility, and effectiveness. Through the implementation of user feedback driven design, evaluate the things that needs to improve in order to achieve the efficiency, systematic, and standardized innovation. Considering monitoring and evaluating the user's feedback can be a key for the betterment of the innovation based on patients' needs, specifically our elderly patient. Future iteration may include voice control, biometric authentication, or integration with wearable health devices. Lastly, these are the visualization of future direction.
Now, let me present the conclusion of our project. The MediTrack Smart Pill Dispenser for better medication adherence offers an effective solution to help solve the issue of mis or incorrect medication, especially among the elderly. By automating how medicine is dispensed and adding real-time alerts and caregiver connection, the device ensures that the patients take the right medicine at the right time. So this helps reduce human error, improves health outcomes, and allows elderly users to be more independent. One important strength of MediTrack is its affordability and user-friendly design. This makes it accessible for more people, even in rural or low-resource communities. It's especially helpful to elderly people who may have memory issues or lack access to regular healthcare. By promoting the responsible medication habits, MediTrack supports better management of chronic diseases and lessens the burdens on caregivers and healthcare system. So overall, the MediTrack combines technology, science, and social care to improve health and empower individuals. It serves as a great example of how smart, inclusive, and sustainable solution can meet real healthcare needs and build a more health-conscious societies. So that's all and thank you.
And that would be all for our presentation. Thank you so much for listening. Once again, this is Meditrack, a smart pill dispenser.